Smith. I'm so very happy to have him with us. Dr. Smith is the dean over at the School and National University of Health Sciences in Lombard, Illinois. Dr. Smith is also a graduate of the Canadian College of Naturopathic Medicine, and more importantly, he's the board chair for the Association of Accredited Naturopathic Medical Colleges. And so he and I work very closely to advance the efforts of all of the accredited schools. I am so very happy to have Dr. Smith with us today. And so with that, I'm going to turn over the control and the screen over to you, Dr. Smith, and we'll be taking question and answer at the end of his talk. So if you have any questions, please start typing them in. I'll try and respond to whatever I can, and then we'll leave the rest for Dr. Smith at the end. So with that, thank you so much, and here is Dr. Smith.
Thank you so much, Dr. Yanez. Good afternoon or good morning, everyone, depending on where you're calling and logging in from. It's great to have you here, and I hope this will be a really informative hour for you. I'm looking forward to your questions, and we'll definitely leave time for those. My name is Fraser Smith. I'm a naturopathic physician, and as Dr. Yanez pointed out, a faculty member and educational leader at National University of Health Sciences, and very happy to be working with the AANMC to advance naturopathic medical education in North America. So today we're going to talk a bit about things that are environmental factors that can strongly influence heart health and metabolism. So often saturated fats or smoking are given a lot of attention when it comes to heart disease risk, and rightly so. They're definitely major risk factors. But we're going to discuss some things that might be more subtle or that the public is not really that aware of. Just very briefly, a little bit about me, which I was asked to provide. I started out at University of Toronto, where I became interested in the early 1990s in naturopathic medicine. I did my ND training at CCNM in Toronto and a residency at CCNM. More recently, I obtained a Master's of Training and Development, which is Adult Educational Strategies at Roosevelt University in Chicago. My research interests are cardiac biomarkers, so risk testing for heart disease. I currently maintain my naturopathic physician's license in Vermont, and I'm a professor here in the College of Professional Studies at National University and essentially chief academic officer for our ND program. I was drawn to naturopathic medicine because I did and still do feel that many people need really deep healing and restoration of their health, not just management of their diseases. A family member of mine then and since was strongly helped by naturopathic medicine, and I had a long desire to work in healthcare, but once I saw how an ND can really work intensively with someone to optimize their own healing and what that could mean for their life, I really wanted to do that for a living. I focus on botanical medicines a lot because I think our bodies just naturally respond to them, and they have some very powerful constituents in them sometimes that can really profoundly influence health. So we call this webinar, Hidden Things, and I thought that has a certain mystique to it, but it shouldn't by the time we break it down. A few concepts around environmental toxins or xenobiotics, meaning foreign compounds. So there's a lot of these that we don't think about, and since the Second World War, sort of in our hyper-industrial economy, anywhere from 70 to 80,000 compounds have been synthesized and put into use that didn't exist before. So really in the last 80 years, people have come into contact with almost 100,000 compounds that didn't exist before. So whether you knew it or not, you're part of a very large, open, uncontrolled trial. And a lot of disease we do know is connected with environmental exposure. And the routes of those toxins can come from air, from water we drink, certainly the food we eat, and from other sources. And of course, we've seen that in the news lately with some very disturbing cases like the Flint water crisis, and also awareness about exposure of children and infants and prenatally even to plasticizers such as BPA. And there's many other analogs to BPA, by the way. So two concepts in toxicology. One is the cumulative effect, which is the results of exposure to a toxin over time. So what happens over weeks, months, years even. So a chronic exposure. The concept of total load looks at the total amount of exposure. So the toxins it's usually a dose-dependent phenomenon where some small level of a toxin is tolerable, a larger amount is dangerous at any given moment, and an overwhelming level perhaps can be lethal. So here's some examples. In the Midwest here, a lot of basements have radon gas leak into them, which can be mitigated, but it's been linked to cancer. So one afternoon in someone's basement that has radon gas isn't going to give you radiation sickness, but if that's your home and you're going in there a few hours out of the day, the cumulative effect over time could be to cause those mutations that could lead to a cancer. An example of total load is one dose of Tylenol is generally safe, but 20 Tylenols, a massive dose, can be lethal. So that really matters when we're thinking about what toxins can do to someone. So our naturopathic principles, which I've listed here, are not just philosophical guideposts for us. These are principles in action. So these are things that we try to effect in the way that we engage patients, in the things that we do. So one that I'm emphasizing here is to treat the cause, which is really, really important when we're looking at why people got sick. How did they get to the present level of health that they have? Now, when we're talking about cardiovascular disease, it's important to look at causative factors. Here's information from the Centers for Disease Control. I snipped this very recently, and it hasn't changed over the last several years except in total head counts, but heart disease is still the #1 cause of death in the United States. Cancer is a very close second. So cholesterol certainly matters in terms of heart disease, although I'll show you a little bit further on that it's not a sole factor or a single factor. Obesity and diabetes are extremely important, but these don't just occur out of the blue. And although genetic predispositions can make someone more prone to obesity or certainly, prone to having high cholesterol in the bloodstream, these causes are themselves driven by diet and behaviors such as stress, sleep, exercise, and certainly environmental exposures. One thing I do want to point out is cholesterol doesn't explain or predict critical cardiac events by itself. So it's certainly a factor that is strongly associated with cardiac mortality. So dying from a heart attack. If you've already had a heart attack, cholesterol levels become much more clinically relevant in predicting what could happen next. But just looking at conclusions drawn from what was called the Jupiter trial, published here in the New England Journal of Medicine, half of all myocardial infarctions and strokes occur among apparently healthy men and women whose levels of LDL cholesterol, the so-called bad cholesterol, that are below currently recommended thresholds for treatment. So having perfect cholesterol by itself doesn't necessarily say you will or will not have a heart attack. Here's something that should disturb you. If we look at obesity trends among U.S. adults, I like this slide. It stops in 2010, and actually the data hasn't changed that much since then. It's got slightly worse and then stabilized. But these color codes along the bottom here tell you what percentage of respondents in this survey were obese. I think the CDC said body mass index over 30, which is pretty fair. The BMI is not perfect as a measurement of health, but once you get over 30, that's getting into some problems. So in 1990, about the time I discovered naturopathic medicine, many states had only about 10% of the population obese, and some even less. So say Michigan or Texas, 10 to 14% obese, or a more active outdoorsy place like Colorado, less than 10%. Fast forward to 2000, those western states now have gone into a whole new color, 15 to 19%, and many of the middle or southeastern states are 20 to 24% of the population obese. New England and some of the Atlantic states parallel the West. Fast forward to 2010, now this area here, which is called the diabetes belt, has over 30% of the population obese, and these areas here, 25 to 29%, and those western states now worse than even, the worst states of 1990. And that has certainly maintained itself. Actually, in 2016, there is now pockets of over 35%. So I was wrong about that. But the general pattern has persisted. It has gotten a little worse and then leveled off, it seems. And good for Colorado and Massachusetts there, and DC, in at least staying in the low 20s. But this is extremely significant because diabetes, which is strongly correlated with obesity, is a major risk factor for cardiovascular disease, as are these other things here. Now, could toxins be contributing to cardiovascular disease? And I don't want to give you the impression that it's all toxins. These are very real and strongly supported by the evidence as major causes, including dyslipidemia, so triglycerides, LDL. There's no doubt about that. Smoking. But are toxins a minor factor or a major factor? It appears that they're a much bigger factor than we thought, with some very compelling evidence behind them. One aspect which has really not gotten enough attention is possibly arsenic exposure, which, when I was in medical school, arsenic exposure was thought, people with exposure to heavy metals in their occupation, or living, eating some very idiosyncratic diet. Turns out it's far more common than that. So a meta-analysis of studies about arsenic exposure concluded that although the studies aren't numerous, the analysis supports the fact that there is a strong association between low, moderate to high levels of arsenic exposure and having heart disease. This book I would really recommend you read if this topic interests you. Dr. Pizzorno here has been a leader in natural medicine for almost 5 decades. He's founding member of and first president of Bastyr University and author of many excellent books. He's always on the cutting edge, and I would recommend this to you if you want to learn more. These areas here have a lot of well water that is contaminated with arsenic, far above what the Environmental Protection Agency considers safe in terms of microliters of micrograms of arsenic per liter of drinking water. So if you get Great Lakes water, like my neighborhood here, it's not such a problem. We have other contaminants, but well water can be very strongly contaminated with arsenic. So this is a bigger problem. And even in some places in Michigan where, again, unincorporated townships are using well water, or they're not connected to the Detroit water system, which actually feeds a big part of southeastern Michigan. There's a lot of it there. This is from another neighboring state of myself, just showing multiple heavy metal contaminations in some of these different counties for different reasons. Agricultural activity, just naturally occurring isotopes, industrial activity, etc. So very widespread. It's arsenic itself, getting back to arsenic, is now being associated with risk for type 2 diabetes. And that segues into something I want to touch on, which is the skyrocketing rates of obesity that we just saw. Now, dietary problems are definitely a big driver there. In my opinion, it's excess energy intake and excess dietary carbohydrate, especially the intake of sugar. Americans, typically adults anyway, take in about 150 pounds of sugar a year, and that's a big metabolic burden. A lot of children's foods are specifically formulated to be really high in sugar. So physical inactivity plays a role. Gut microbiota, so the gut flora that we have, this is a fascinating area. The type of bacteria that live with us and vastly outnumber us in our gut may make products, well, do make products that influence our metabolism, and in some people are making byproducts that are hijacking their metabolism and making it easier for them to gain weight or even develop diabetes. Environmental toxins, it turns out, may also be a driver of obesity. So the science behind this is in the area of endocrine disrupting compounds, and these can be related to a lot of things: heart disease, obesity, infertility, premature puberty, depressed sperm counts in males, lots of things, breast cancer possibly, quite strongly. So the term I want to leave you with today is obesogen, and I can answer questions about this after the presentation, but obesogens are compounds that accelerate the process of becoming obese. They're not necessarily acting in isolation, but they cause some sort of metabolic disruption that leads to greater accumulation of adipose tissue in the body, so these cells that produce fat and store fat in the form of triglyceride, or disrupt the function of the hormone insulin in some ways. And those two things are not mutually exclusive. Now, in the diet, things like fructose, monosodium glutamate, even genistein from soy, nicotine, which we don't want a lot of in our body. Nicotine is a big influence in what's called the autonomic nervous system. There's pharmaceuticals, hormones like this, and what I'm very interested in, industrial chemicals such as bisphenol A or phthalates. Now, you may be quite familiar with this, but plastic is strongly treated with these compounds. Plastic is treated with these compounds so that they don't crack, that they have flexibility. So the fact that a water bottle doesn't crack when you squeeze it is due to the application of these compounds. And although compounds such as BPA are now being taken out of plasticizers, similar compounds take their place, so those plastics are still industrially useful. And the bad news is they probably have similar effects. When my children were little, I really had to go to the ends of the earth to find chewing toys that did not have plasticizers in them, that were made with medical grade silicone. I was only able to find one manufacturer in the world, at least that I could shop for, that made these. So they're very ubiquitous. Just look around where you are right now, wherever you're sitting, and look at the plastics around you. We live in a very heavily plastic world. Some of these compounds are also found on receipt paper. So they keep the ink from smudging. So people who handle receipt paper, cashiers, baristas, tend to have many, many more of these compounds in their bloodstream on a given day. And then we have things like dioxins, PCBs, which come from the electrical transformer equipment, pesticides, which, as you know, are used very, very heavily, and even things like lead. So we don't have time to break down all the biochemistry around this, but the thing that I can tell you is that these compounds affect different targets in the body. They affect different targets in the cell and cause or accelerate obesity through different mechanisms. So they can cause more synthesis of fatty acids in the body. They can make those fatty acids more toxic in the body. They can cause cells to store those fats more readily. They can cause cells that are pluripotential, so cells that can eventually grow up to be different things. You've probably heard about stem cells and how important they are. And some of these compounds seem to be able to encourage stem cells to differentiate or transform themselves into more adipocytes. So not only influence the way that our fat cells behave, but get our body to start to make more of them, which is something that doesn't always happen. So some pretty strong evidence there, and obesogenic in the sense that they don't just play with our metabolism in a random way, but seem to push things along a path of creating obesity. More fat cells, bigger fat cells, more active fat cells. Once this phenomenon takes hold, these fat cells start to do things. They start to hijack other processes in the body in the sense that they will increase appetite, postpone the sense of fullness during eating. So like all tissues, they want to be fed. And unfortunately, right up until the point of morbid obesity, at which point this starts to break down, but they start to drive more calorie consumption and more behaviors. So the fact that a person who's morbidly obese craves certain foods, it's not just a habit. They are literally responding to their own physiology at that point. We know that disrupting gut bacteria through antibiotic usage can occur. Here's some neonatal exposures to the drug DES, which is a prohormone, and see in controls versus the research subjects, they were absolutely set up for obesity during their neonatal period, so prior to birth. We do have to talk about diet a little bit, and you could argue that the amount of sugar in processed food is so high that it almost starts to act more as a toxin than a food, but that's a debate we can leave for another day. We do need to realize that the amount of sugar consumption, especially in children who are developing obesity at a very fast rate, and diabetes and prediabetes, has really, really gone up. Processed foods and a loss of cooking skills, which is no coincidence. These go hand in hand. About a third of American children eat some form of fast food every day. This has certainly worked against good eating habits. So I like to put up the United States of fast food here. Now, some of these as an occasional treat, or some of them like Panera, you can make out pretty well there with some intelligent choices. But we really excel at creating these options. If you want to learn more about this subject, here's some recommended reading for you. Here's a classic, Sugar Blues by William Duffy, which is goes back about 45 years, but it's just a great history of sugar. White sugar, table sugar, really wasn't added to the diet until about 150 years ago, It was first characterized by Arabic physicians about 1,200 years ago who were very, very advanced in creating new medicines. And it was a crystalline substance that was only to be used as a stimulant for patients for a very short period of time. No one envisioned that children would eat 100 pounds of it a year. This book here, In Defense of Food by Michael Pollan, is really good reading too, and he really argues for getting people back to eating just food versus fake foods or food-like substances with flavors injected in them, which, as someone with young children, it's a challenge to keep them on track of loving real food versus food that's foods that are an impression of food. So say to want to eat free-ranging chicken versus a chicken nugget. I have had quite a bit of success with that, but when this is your landscape, it takes a fair amount of vigilance and a sense of humor too, and good cooking skills. This is a more recent book, Salt, Sugar, Fat, which talks about the processed food industry. One thing I learned from reading this is that General Mills, which created a lot of the breakfast cereals that children eat, was owned for a long period of time by Philip Morris, which was the tobacco giant. And the marketing strategies and addiction strategies that the tobacco industry developed over years were translated into the breakfast and processed and children's food strategies to really refine the taste experience of processed food in a way that really takes over the brain. And so it's a really fascinating read. It's very well researched and very calmly presented, so you might find that interesting. I know some nutritionists say there are no bad foods, and I understand their point is, you know, everybody maybe likes a donut or a slice of pie once in a while, but the idea that, well, there really are no bad foods is a very naive point of view. The reality of the situation is that obesity and heart disease, which are epidemics now, start in childhood, and the children are the targets for things like this. So, say Jif cereal, if we look at the label here, that's 13 grams of sugar per serving, with hydrogenated vegetable oil, which is really a poison for the metabolism. Honey Smacks gets up to 20 grams of sugar per bowl. Most children will do like 2 Pop-Tarts in the toaster, so that's 15 grams of sugar per pastry. So that's 30 grams of sugar as a breakfast. Now, the recommended daily allowance, the RDA of sugar for an adult of processed sugar is, simple sugar is 30 grams a day. So just by breakfast, a child eating this kind of food has now met the RDA of sugar for a person twice or 3 times their body mass, plus the orange juice, plus whatever they do for the rest of the day. And I want to end on a couple quick notes and leave time for questions. So maybe we'll recap some of these during the question period. Not all fats are created equal. A lot of people know about omega-3s like fish oil. What they may not appreciate is that cooking vegetable oil, which a lot of restaurants use and a lot of people use at home because they've been told, yeah, eat vegetable oil, it's good for you. A lot of these oils are heavily processed and very damaged. So they don't taste too bad because they've been deodorized and bleached. So some of the nasty tasting things are taken out, but they're not very metabolically useful, and you could argue rather toxic. So the process of making these oils that sit in these pretty bottles on the store shelf is actually a very complicated process. These are done on such a large industrial scale that they are less expensive than something like extra virgin olive oil, but the savings in money is not worth it. There's some pretty good evidence now that unsaturated fatty acids do not reduce risk for heart disease. And in fact, if it's these kind of acids, vegetable oils, they may be contributing to the product. Now, healthy vegetable oils like cold-pressed oils from walnuts or flaxseed oil that if it hasn't been heated, if it has not been heated, or olive oil are actually very friendly and helpful to us, but the bulk of the oils in the supermarket and in restaurants are not helpful at all. Here's some recommended reading if you want to look at this more. Deep Nutrition by Kate Shanahan. This is a brilliant book, and she gets into the pillars of the human diet that most peoples in most cultures at most times have followed, except until very recent times in industrialized societies, we've strayed from this. So that definitely includes plants, fruits and vegetables, but also fermented foods, sauerkraut, lactobacilli, kimchi, and this is a really good common sense approach that I think a lot of patients can follow without making their life too complicated. Now, just to make you aware of this, is there anything beyond getting an annual cholesterol panel that can help patients? Yes, there is. And I'll just take a couple minutes on this before I pause for questions. These are inflammatory markers, and we're doing research on this right now and will be for the next several years. We use this in our clinic. These tests here tell us how inflamed is the lining of someone's arteries, and if they have what's called atherosclerosis, so hardening and clogging of the arteries, how fast is it accelerating? We can now get really good, well-validated data about this for our patients. It doesn't mean that we disregard their cholesterol panel, but this tells us what is the state of affairs in their artery. So the way to visualize this, if this were someone's arteries when they were 6 years old and perfect, and this is their arteries the day before they had a heart attack, you can see that they're building up these plaques of cholesterol which get bigger and bigger and eventually rupture. One day they had a heart attack because a blood clot formed, but all along inflammation was the driver. The cholesterol was an important ingredient, but the driver was inflammation. And these enzymes, like C-reactive protein, but also MPO, can tell us about risk over the next 5 years, or even risk over the next year. So these events are easy to understand once we look at inflammation levels. So everything from, if you're in your 20s listening to this, you can get an isoprostane test and see how much free radical attack is going on, not just across your whole body, but against your arteries. And if you have high oxidative stress of that kind, you have a 30-fold increased risk of developing metabolic syndrome and possibly heart disease. We can see how oxidized, how rancid your cholesterol actually is. We can see your background level of C-reactive protein. We can see if your kidneys are getting damaged. And this would probably be my favorite here, the MPO, because it can tell us how fast those plaques are growing. Later on, we can see how unstable they are and if they are at risk of rupturing. Some people go to their grave in their 90s with stable plaques. Others, unfortunately, have a heart attack in their 50s with a plaque that ruptures. And we've got really good ways of determining this now. This doesn't replace other tests. It's just a great adjunctive test because we really don't know always how cholesterol is going to behave. We need this other data. And why not get this for our patients? I'll end on this note that even HDL, which is considered the good cholesterol, now in a lot of our adolescents, a lot of our children, has already turned into a pro-atherogenic particle because of inflammation, which is really should disturb you, the fact that even the mechanisms in the body that are meant to prevent atherosclerosis could be working against you. So typical case here, 48-year-old male with one reading of elevated LDL and a very strong family history, turned out had slightly high normal plaque test. He's gone on to fish oil, Mediterranean style diet, and will have follow-up testing because of this. I'm not going to go too much into my own bio about this, and I can get back into my weekly routine and some practice success tips at the end. I really want to open this up to questions now. Thank you.
Thank you so very much, Dr. Smith. I really appreciate that. So before we get going on on some Q&A, I just wanted to let the audience know that we've got some upcoming events that are really exciting. Next month, so as you know, AANMC hosts webinars like this every month. So next month we have Natural Approaches to Weight Loss and Weight Management on March 27th. And we're also going to be hosting our virtual fair on April 11th. All the A&M schools, all day. So I hope that some of you will be able to make it. So with that, I'm going to start on some of the questions today. So Dr. Smith, why don't you just go ahead and start with, you've got the tips for practice success up, the slide up. Why don't you go ahead and start with that? I know, very often when I talk to prospective students, when I talk to applicants, they ask me, what does it take to be a successful ND? Obviously, you have been an ND for a number of years. You've trained probably hundreds of NDs through the course of your career. So, it would be really wonderful to have a few of those tips from you right now.
Sure, thank you. I think getting to know yourself is a really important thing in being successful in practice. And what I mean by that is to start to think about where you're going to thrive and what you're doing to prepare for it. I would even tell you, if you don't have a strong sense of whether you're an entrepreneur or you're like myself, you just love working as part of a big organization and being part of that, or you like being on a team of 6 people, say yourself, an MD, a chiropractor, a massage therapist, get to know that about yourself. You can do something simple like a Myers-Briggs test, or find someone who's licensed in what's called the Berkman method, which will look at your needs around that. And certainly get out there and shadow people and see what kind of practices appeal to you. So envision what you want to do, even now, even before starting medical school. Start planning. Plan how you're going to make it work. Plan how it's going to be financed. Plan where you're going to put yourself so that people can find you, and plan how you're going to present these wonderful things that you have to offer to people in a way that they can accept it, that they can use it, that they can tell their friends about it, so that you learn how to communicate things like this. So, for instance, how would I discuss the things that Dr. Smith just discussed with me in a way that might help people to wake up, but wouldn't be terrifying or wouldn't sound like scare tactics? How would I teach people about avoiding environmental toxins? You want to network, and this is a great thing to do. We do it professionally with integrity, but finding out people that can work with you. It's amazing how many wonderful people there are in the world that want to give you help to get to where you want to go when you have a good goal. And I've had so many people just taking an hour out of their day to have lunch with me, to share something with me that really helped. Prepare yourself, do things beyond school even that might be needed. If you need training in business, go and get that, or training in other therapies. Focus. I find, students get more focus as they go through school, but to realize that virtually everything you get in medical school will come in handy sooner or later. I remember having a class in stress management in my first year of school, and I was a good student, but I just couldn't connect with these instructors, and I kind of sat there as a disengaged student. And guess what? 3 years later, most of my patients needed strategies for stress management. So I read up and I caught up and I was able to do those things, but it never really pays not to be tuned in. Strive, so go for your goals, knock down the walls of your limitations. Don't tell yourself you can't do something if you're not, you just have to be willing to put in the work and listen to guidance. Persist, evaluate as you go along. Is it what you want? Is what you're doing working? And have fun. I come to work every day, and sometimes it's challenging, but I really enjoy what I do. I love being involved in naturopathic medicine, and my interns and my students and our faculty here are pretty amazing people. If what you're doing seems like a grind most of the time, 10% of the time is okay, but if most of the time it seems like a grind, something's wrong. So these are the things that I could impart to you.
Wonderful. Thank you so much. So I've got a couple questions that have come in. One here, so this is more of kind of a practice management issue here. So she talks about her mom, who's a 71-year-old patient, and the conventional medical doctor is not wanting to do CRP levels or test her for heavy metals. So can you talk about, not necessarily specifically what this person can do, but how NDs work within the medical system, and and some advice in situations like this when maybe there's a member of the team that doesn't understand things, and what you would say to that.
Well, I would say at the end of the day, we're responsible for our own health, and I know that I've certainly had patients that felt uncomfortable going against their physician, and I'm very understanding about that. It's easy to tell people to go and lock horns with their physician, but and especially if maybe they're of a generation that was maybe more deferential to physicians, although I've seen all of that change a lot. Physicians are just doing their best to help people as well. So my recommendation for someone in that situation is find a naturopathic doctor who maybe can help fill in some of those blanks, get that additional information, develop some other treatment strategies that can reduce risk, screen for things and reduce risk. It's important, and maybe even a family member will go, with that family member to the visit and interview the naturopath. You definitely, in this situation, want someone who can communicate, who, I've had to do this in the past, is write a letter for a medical doctor or have a phone call and just explain what I'm doing. Someone who is sensitive to the fact that maybe this patient will take medication, and to find things that don't cause interactions or don't cause any adverse effects because of a drug-herb interaction, and could do things, I think, complementary in the best sense or integrative in the best sense. So given the person's age and the fact that they're already working with an allopathic physician, it sounds like you want someone who is pretty used to primary care and is more on the integrative side. And I'd say if a medical doctor has a problem with that, I think the patient needs to ask, well, provided they're not trying to take me off of medication and they're willing to share with you what they're doing, what's wrong with this? I mean, I definitely want to be as healthy as I can. And I found that most allopathic physicians are quite supportive when things are put on those terms.
Yeah, there's one thing that I would add to that as well. I think oftentimes people forget that as a patient, you are a consumer, and you do have the right to find fits that are better for you. And we get questions at the AANMC often, from patients who are looking for NDs, and I tell them, even when they're looking for a naturopathic physician, NDs practice in many different ways. There's a lot of flexibility in the degree and how you can work as a naturopathic doctor. And so it's very important to interview folks to find a good fit for what you're looking for, and what, what your health goals are. So I would just leave that in your mind as we move on to the next question, that, feel empowered as a consumer to choose what you need for your health. So Fraser, I've got, Dr. Smith, I've gotten 2 questions in from career changers, some 40-year-olds who are thinking about going to naturopathic school and wanting to know if it's too late, or how will that be for them. And I know we've answered that. We actually had a career changer webinar last month that we host every January, and we've got archives of that on our website. But maybe if you can speak to some of the career changer students you've seen, and how some older students can succeed.
Yes, I'm so glad someone asked about that, and it is not too late, and we need your experience, we need your skills. My intern regiment over here is a real mixture of people, some of whom have had 25-year careers in other disciplines, and some have come to us straight from a baccalaureate. And that just strengthens the profession, not only the life experience, but also, the skills that people bring in all kinds of things, science, financial services, business, political engagement. One of the greatest influences on my career was the late Dr. Anthony Godfrey. I met him in 1992. He was a PhD in anatomy. That's what he was teaching me. But at the age of 46, he decided to leave conventional medicine research, which is what he was doing. He had a PhD from University of California, Los Angeles, one of the best anatomy schools, and I think was a dean of health sciences at a northeastern university in Massachusetts. And he left it all, moved his family to Toronto, and became a naturopathic doctor. And he practiced for the next 24, 25 years, and was a brilliant herbal medicine practitioner. He also taught us botanicals, and I sat in on his practice and watched him work. And he helped so many people and had such a great time. He was very successful, and there was no the human brain has so much capacity to learn. The more we learn, the more we're getting better at learning. And Anthony knew hundreds and hundreds of herbal medicines and exquisite scientific detail, as well as the traditional usages of them, and was a great doctor. So we have these shoulders of giants that we can stand on. So I would say, on the practical side, think about how to fund it. Think about what rate to start at. Do you need more biochemistry before you start? Should you start on a reduced load, which is not part-time? All of these different loads at different schools are very robust, but often I find if someone is coming from, say, accounting, or they were a licensed teacher or something, the first 8 months are intense because they're doing a lot of basic sciences. And then after that, they're just like any other student. And I often find in clinic that their life experience helps them excel. So everything comes together. So that's what I could tell you.
Thank you so much. So we've gotten a few questions here, and let's see. There is another question on whole food and plant-based diet, and if you can speak to your feelings on that.
Well, eating those two categories are a really good way to stay healthy. On the plant-based side, we know that plant-based foods, for the most part, reduce our risk of heart disease. They tend to be high in fiber and low in sugar and reduce the risk for obesity. They have a lot of compounds in them that are beneficial to the body. The World Health Organization says that they reduce risk for cancer. Obviously, eating a lot of plant-based foods isn't a fail-safe method not to get cancer, but the evidence says it really reduces our risk. My opinion is you can have animal-based foods, especially from the appropriate sources. So say animals that are really well treated and also are eating their natural diet. But however you do that, as Michael Pollan says, eat a lot of plants. Actually, he says eat mostly plants and not too much food in general. Whole foods is very, very important. And the thing I find about it is this, is for decades we've been looking at breaking food into its components and having debates about how those molecules stack up against each other. Is protein more important than carbs? Is gluten good? Is gluten bad? At the end of the day, it seems like if you eat foods that are in their most unadulterated form as much as you can, you really end up avoiding a lot of things that aren't good for you, like excessive sodium, like trans fats, like enormous amounts of added sugar. So whole foods are a really good place to start, a really good place to end.
Thank you. Can you talk a bit to some of the heavy metal detoxification you spoke of? I know somebody specifically asked about arsenic, but it might be good to just speak to some of the heavy metals.
Right, that's definitely something to do under medical supervision. That can be a naturopathic doctor. That could go one of two ways. They may do things like sauna therapy plus nutritional supplementation that provides compounds that can help bind to those toxins. There's a lot of steps in the body getting rid of it. It's the body getting rid of it. The physician doesn't reach in and take it out. The body has to move those things literally through several layers of tissues and cell membranes. So an ND would typically nutritionally support that, help them limit exposure, obviously, and so cut the sources of those things out, and then maybe do something like supervised hydrotherapy, saunas, that help mobilize it from the body. But that has to be done under supervision. Some NDs use intravenous therapeutics with more targeted medicines that help pull those things out of the body, and medical doctors use some of those things too, like chelation therapy for lead. The good news about something like arsenic is that over time, our body can get rid of it. When we get, and the plasticizers like BPA actually can wash out of the body in a matter of days. The problem is we're exposed to them constantly, so our total load at any given moment remains high. Those things like PCBs, those real fat-soluble toxins like dioxins, which are even found in the Arctic now, in the breast milk of polar bears, they are very, very biopersistent. So they get into our fatty tissues. They could stay there for decades. So that is more challenging, and that is still possible. The heavy metals obviously are no joke. We saw what havoc the drinking water crisis in Flint and other places has caused. But we do have specific strategies for that, although it does need to be supervised.
Thank you so much. So let's see, we have a couple other questions coming in. There was one about career options and what types of careers are out there for folks after they get their ND degree.
Yes, this is great. This is something that we think and talk about often. There's many different ways the ND can go. Now, our recent our recent look into this question over the last 3 years has told us that a lot of naturopathic physicians, a lot of graduates still pursue opening their own practice or a practice with a classmate or some kind of associate. But more and more ND graduates are now joining larger groups. It can be, a group of 4 or 5 practitioners, or even joining an integrative medicine practice where there's different disciplines combined. I believe that there is going to be more of that in the future as the reimbursement for healthcare becomes more results-oriented and costs versus results. So it becomes more about results than methods, becomes more about outcomes than modalities or therapies. And it does seem to be an increasing trend. NDs can be found at some hospitals. NDs can be found working in public policy roles. I know two of my former classmates from Toronto ended up working for the Canadian government, running the Department or Office of Dietary Supplements, or eventually, natural products, essentially helping make policy for how dietary supplements are available to the public. NDs can get into research. A former student of mine went on to actually get his PhD in biostatistics and clinical epidemiology, and he is a faculty member at a major research university now, tenure track. So we go in different directions, and again, I would say, come back to start to think about who you are, what makes you happy. Do you like to focus on one thing at a time? Do you like to have a lot of irons in the fire? Where's your usual interests? What makes you feel fulfilled? Most of us, I would say, we like to be around people. That's how we got into this field. But there's many things that can go. So smaller practice is still a big component, but I would say barely the majority now. If more and more NDs join groups, and of course that's the trend in medicine as a whole.
And I just had a question come in to kind of tack on to that. I'm typing a little answer here, but can you speak to NDs in hospital settings?
NDs in hospital settings, for the most part, work as part of an integrative team. So to take the example of the Cancer Treatment Centers of America, they have several hospitals across the United States. I know in a place like Metropolitan Phoenix, the NDs there have a medical license with a very broad scope of care. But even in that context, I imagine a radiation oncologist would have a lot of authority in directing cancer care. We have a Cancer Treatment Centers hospital just north of here in Illinois, and they have a naturopathic medicine staff, and they work as part of a team, an integrated team with oncologists, surgeons, nurses, nutritionists, psychologists, social workers. And so every day they go to work in the hospital and have a caseload and have weekly meetings with, with a team. Not just they have their own team meetings of NDs, but they sit through, tumor boards essentially with the oncologists and others. So, and of course, that's the nature of hospital work, is that, multiple practitioners are involved in a patient's care.
Thank you so very much. Oh gosh, I see that we are right at time, and I know that you have a class to teach. So I want to thank you so very much, Dr. Smith, for joining us today for our webinar. I hope that this was helpful for all of you. I will stay on for a few minutes if there are any additional questions that I can respond to. For more information, Dr. Smith, if you can put the info slide up really quickly with the contact information for the AANMC, that would be wonderful. There you go. So info@aanmc.org for any additional questions that you may have. Our 800 number is up there as well. And as I said earlier, we will have a slide, the sorry, the recording of this webinar up on our website and our YouTube channels in a little bit. And so with that, I thank you all so very much for coming today, for being attentive and asking questions and using your brains and thinking about this really rewarding career in naturopathic medicine. And with that, I'd like to conclude today's session. So thank you so very much, Dr. Smith, for taking your time to share your knowledge with us today.
Thank you, Dr. Yanez, and thank you, everyone, for coming today. Bye-bye.
Bye-bye.